Many people who are living with overactive bladder syndrome don't talk openly about the impact it has on their emotional, physical, and psychological well-being, and instead just learn to endure the symptoms. Pharmaceutical company Astellas are committed to helping those living with OAB to feel empowered and to speak out and seek help.
I had one particular teacher, and I think I must have been about 8 or 9 at the time, and she was forever sending me out of class to go and stand outside. Oh, you know, you're doing it to seek attention. What is it now, Josephine? You know, what's the problem now? Each time I wet myself. And, you know, when you're standing there with a puddle or sitting there with a puddle underneath you, yeah, it wasn't great.
Josephine has a medical condition called an overactive bladder. This is caused by an abnormal communication between the brain and the bladder. It gives her an urgent need to pass urine, with little or no time to get to the toilet. She's had it all her life, making her feel isolated and different at school. She was 37 years old when she was eventually diagnosed, and 41 when she confided in someone outside of her family. She'd endured years of suffering and silence, impacting all parts of her life.
I was delivering a presentation, I was delivering some training, and I had a complete evacuation. Just walked out of the office, never went back. And that was me, it wasn't them. They said, well, you know, don't worry about it. But the humiliation was such that I couldn't go back.
Overactive bladder can affect people of all ages, including children and the elderly. About 12% of the total adult population suffer from the condition. For Josephine, it also affected her love life, keeping her condition secret in relationships. And how did it impact you psychologically?
I think it led to an element of body dysmorphia because I felt disgusting, I felt unclean, I felt different, there was shame, and I think that manifested in as to not just psychologically, but how I felt about myself physically as well.
Enjoying life can be a struggle when you have a bladder condition, but there is help out there to manage it. Dr. Tim Patel is the medical director at Astellas Pharmaceutical Company and an NHS GP. Astellas has been looking at improving the working relationship between primary and secondary care to stop people dropping out from receiving help.
So we know that while people are waiting for investigations and treatment for overactive bladder, they actually drop out. So we think about 30% of people drop out, which is about 500,000 patients. So we wanted to create an optimal pathway for them to be treated, and also that to be adopted in different areas. So in some areas they do it well, and some areas they don't do it so well. So the idea is that Astellas could highlight to the areas where there could be improvement and show them a gold standard way of doing it.
With support and treatment and advice, Josephine manages her condition, going from being wet every single day to now just 3 to 4 times a week. She loves hiking and is doing a Master's in Medicine, Health and Public Policy.
I do receive really good clinical support from the centre where I go, from the hospital, and I think that that's been quite crucial. And actually talking through with the nurse specialists there about how I feel about it and how, you know, it can make me feel quite sort of depressed and anxious at times has been a real source of support, and I think that that's been crucial.
There is now lots of support out there, including a website by Astellas to help people understand the condition more.
As people are getting more educated about things that might affect their life, including overactive bladder, they can access interventions earlier, and that's becoming more normal. Unfortunately, there's still a stigma around things like urine and bowel problems, but as people talk about it more and things like mental health are destigmatised, people are feeling more comfortable about coming forward.
I've spoken to friends who have young children who are still a bit wet, and it does seem that it can be a little bit patchy, but I think that there are far more support networks out there for parents and for young children, which I think is to be applauded, because I wouldn't want any child or teenager, I think teenage years are critical, I wouldn't want them to suffer in the same way that I did.